Hello, this is Chelsea Marks, and we're filming for VETT 220, Task 43, which is an intravenous catheter. So here's our OCCI certificate here for Evergreen Veterinary Hospital. And we have our patient here that's going to get a catheter, an IV catheter in the left cephalic vein. So we have our tray of supplies assembled here, our clippers, our adapter port here, our VETT wrap, our IV catheter, which is a 20 gauge. Our heparinized saline, which is 1 unit to 1 cc, or what I have here is 3 units to 3 cc's mixed, and we have some surgical scrub and alcohol to prep the site with. I'm going to go ahead and clip. Hello. Okay. Good job. You're okay. Good job. Good job. I know, please. You're okay. Shh. Good girl. Okay, one thing I forgot. You're okay. I have to grab one piece of gauze here. And we also have some gauze to put around the distal portion of the catheter once that's prepped. Do you want to lay back down? Lay down. Good girl. Shh. Hey, it's okay. You're going to be okay. Good girl. Okay, so first thing we want to do is flush our catheter. You're okay, girl. Okay, so got our catheter out here. I'm going to make sure that that is flushed and patent, and it is. Some of our cap. Okay, so now we have our site clipped here, and we're going to go ahead and start scrubbing. So we have 3 scrubs, starting in the middle in a bullseye, going to the outside, and then with alcohol, and then with another surgical scrub, and another alcohol, and on the third one, making sure we don't touch the outside and then come back in. Okay, so I'm going to have my assistant occlude the vessel. We have our flushed, heparinized saline flushed catheter here. Checking to make sure it slides off. It does, and that you can take the cap off easily. So we're going to take our gauze here, preventing any hair from coming up into it. Bevel up, we're going to find the vessel here, and we have flash. We'll keep inserting. And then slip the catheter off the stylet, and the assistant is going to hold pressure there. And for a second, we're going to have that little cap there while we tape it in. So we have our second piece of tape there. And then we're going to go ahead and put our cap on. I'll have my assistant hold one more time. That's stuck to tape. Okay, so we have that in, and one more piece of tape across that port. Get rid of our pokey things, and then some VETT wrap over the final tape. And then again with our flush, just making sure that it's patent, no air bubbles in that. Flushing with at least 2 cc's. And that looks good. We're going to go over some of the discussion points here that we need to go over for the IV catheter placement. So we have our patient here, a little giraffe. So I'm going to zoom in so you can see better. Actually, go out a little wider and point down. Okay, so first thing we want to discuss is some potential complications with our IV catheter. So when placing the IV catheter, you want to be really sure that you're not placing it too high up in the elbow area here. So this is a good example of one placed just a little bit too high. So when the patient moves, it's going to become really positional kink, and you're not going to have good flow. So you want to place the IV catheter a little lower on the leg than way up here in the elbow. So that's one thing you want to watch for. Another thing that could happen is the IV could kink. So the catheter itself can do this little kinky guy here and look like that. So when you put it in the arm, you want to make sure, in the leg actually, that you flush it really well and make sure that it's still patent. So that's one thing you want to watch for. Another thing, so you can also use some VETT wrap. So we have VETT wrap here. You want to wrap your catheter really well with VETT wrap so that the PET doesn't bother it. So you have your VETT wrap here. You want to go ahead and place that around the leg. So what I'm doing here is demonstrating placing it too tight. So something that you should check for frequently is the color and the temperature of the toes. Look for any swelling, check the CRT, make sure there's good blood flow to the toes. So if this is on too tight, you're going to have what we call mega paw. So the paw is going to swell really large, and you're going to have some fluid buildup because the return is not happening. So it's coming down and staying down, swelling in the bottom of the leg. Another thing you want to look for is up here above the catheter site, more proximal to the leg here, there could be swelling up here as well. So if the catheter is no longer patent and it's the fluid's going extravascular, fluid's going to build up here and cause swelling above the wrap. So you want to watch for that as well. Some things to prevent that from happening. You can put one of these little stabilizers on your patient. And it doesn't fit him very well, but get the idea. So you can put a little stabilizing splint there, some VETT wrap, and some cast padding around that. And that keeps the leg straight so that you're not getting kinking or positional catheter occluding. So there's a little splint there. And another great thing is our e-collar. So patients love to chew out their e-collars, or chew out their catheters. So you want to have an e-collar on your patient, and it makes sure that their nose doesn't extend past the end of the collar, because then they can eat their catheter. So those are some problems that can happen with your catheter, such as kinking, positional occlusion, and patients chewing the catheter out. And the stabilizer, the VETT wrap, or no chew, and the e-collar are ways to prevent the patient from having problems with their catheter.